And with that, we have another colleague of mine from Columbia Business School, Professor Jing Dong, and really happy to have her here. She is one of the professors in the digital health program and extremely accomplished researcher and professor in the area of understanding operational decision-making and predictive analytics. Hello, Jing, how are you?
Hi, Stan. Good. How are you?
Good to see you. It looks like you're in our new building in Manhattanville. Is that correct?
Yeah, we just moved here this month.
Outstanding. Well done, and congratulations on that too. How do you like your new office? Fantastic. So let's talk a little bit about some of your research. I know you're constantly publishing. It's always fun to hear about what you're doing, and maybe you could tell us a little bit about some of the new opportunities in telehealth that you've been seeing and you've been researching.
Yep. So I think this is simply a very exciting area for people to look into telehealth. Right? During the ongoing COVID-19 pandemic, we've basically seen a rapid growth of telehealth being applied in different areas of healthcare. And many has viewed this growth not only as a solution to our current problem, but also as basically this is an innovation whose time has come. So even after the pandemic, we will hope to see a continual growth and more wide applications of telehealth. So I think this is just a very exciting growing area that would call a lot of research and innovations. And telehealth we've seen takes many forms, including like remote patient monitoring. This we've already seen it even before the pandemic. And then there's also more forms of remote consulting that we've seen happening and growing during the pandemic. And also even remote ICUs that solves really the access to ICU physicians problems.
That's wonderful. And again, the kind of telehealth growth is amazing, right? Because it is all over. It's coming up now in specific areas like women's health. There are specialized telemedicine programs and telehealth and virtual health programs there. But obviously with the growth of telemedicine, telehealth, and virtual health, there are going to be some challenges, I'm imagining. What are you seeing developing there?
Yeah, so I think in general, people still have a lot of concerns when they think about using telehealth, either from the patient side or from the provider side, right? So there are concerns about how do we measure the care quality? Do we actually have compromised the quality of care if the care is provided through telehealth? And then there's also issues about safety and privacy concerns about personal healthcare information. And then also most importantly, because this is a relatively new form of care providing, so there's a lot of lack of consensus and best practice about simply how it should be implemented and operated in practice. So I think all these are very interesting areas that would call for more like analysis, research, and innovations to address these problems. I think even before the pandemic, we've seen successful application of telehealth in areas like managed chronic conditions and also behavioral health, like providing psychological consultations through telehealth. And there we have more concrete study actually measure the benefit in terms of quality of care. But during the pandemic, we've seen telehealth being applied to other areas that traditionally they were not widely studied. For example, like primary care, a lot of us start seeing our primary care physicians to telehealth. And there's also pre and post surgical care. And even emergency care, part of it, the triage process are now, some of them are considering providing them through telehealth. But in terms of like, what's the implication of these new care providing strategies on patients' health outcome? It hasn't been well studied, and we would really need to see more study to address the quality issue in order for people to believe this is the right way of getting care or this is the right way of providing care.
That's fantastic. And you've done a lot of work in efficacy and understanding from the decision-making and the operational research side of things, how effective these new programs are. Tell us a little bit about what you found around the integration of telemedicine and in actual on-site visits, in-person visits, in outpatient ambulatory clinics, and what you've done using data analytics to come to those conclusions.
Yeah, so that's a very important question. I guess part of the thing that people don't really know is how to effectively incorporate telehealth into their day-to-day operation. One of the organization that I'm working with is an outpatient clinic in New York City. So they provide now both in-person visit and telehealth visit. And some of the basic questions simply like, how do you schedule telehealth visit to integrate them with in-person visit is not fully addressed for these clinics. So for example, should I schedule them in a mixed way? Should I see like telehealth alternating between telehealth and in-person visit, or should I have blocked time for just the telehealth versus just in-person visits? These are actually largely unclear to the physicians or to the healthcare management. So what we need to know in this process is basically how different modality of visit will affect the patient's behavior. For example, their on-time behavior, their no-show behavior, variability about their service durations, and also on the physician's behavior, how much control the physician has about being on time, and how much control do they have about the service time and quality. So all these actually require more careful analysis of the data, and predictive analytics would also help us building predictive tools to do more personalized scheduling policies for both the physician side and the patient side.
That's great. Well, thank you very much, Jing. I really appreciate you joining us. A virtual round of applause from the hundreds of people listening around the world. Have a great day.
You too. Thank you. Bye.
And again, just the research that Professor Dong has done over the last few years in virtual health has been extraordinary. So do look her up on Google Scholar, look her up on LinkedIn. And again, she's very much one of the leaders in this area, operational research and decision making.